Welcome to Computer Talk's Pharmacy Forward video series. I'm Maggie Lockwood, Director of Production at Computer Talk, and in this three-part program, I moderate a panel discussion with Blair Thielemier, Pharm.D, founder of the PharmapreneurAcademy, and Heidi Polek, Strategic Program Manager at DrFirst. We are going to look at the topic, the road ahead, how pharmacy can move from a dispensing-based model to a clinically based one. Blair and Heidi give excellent coaching around implementing pharmacist-inspired programs and how best to use your pharmacy system and communication tools to collaborate with providers and connect with the community. In part one, we will talk about preparing for the journey away from the traditional dispensing model by keying in on topics and trends that are of personal interest. In the second segment, we work through an example of turning a passion into a unique clinical offering. And in the final segment, we talk about building your team as well as implementing technology that support your vision. Both Blair and Heidi are happy to answer any questions, and their contact information is available at the end of the program.
And I think, too, finding a champion in your pharmacy, we all have our strengths, and as a team, we're going to be stronger together. But you're always going to have someone who's more interested in doing the scheduling part or, the delivery part or the packaging part. So find your champions. Once again, especially in independent pharmacy, as I said, this is really a team effort going on. Present everything to the team, work on this as a group, take everybody's input. And if you've got a champion who says, I'm going to run with the scheduling part, let them run with it. Don't try to, this is one thing pharmacists try to do. We try to do it all ourselves.
Mm-hmm.
Don't shoulder the entire burden yourself. Somebody's going to have some strengths that you don't have. Let's use everybody's strengths in your pharmacy and you will definitely succeed that way. So that's what I would do. Just call a big group meeting together, talk it out as a family organization and get everybody to, work to their strengths.
Heidi, you had talked about internships and bringing in someone who might have, like you're saying, an expertise. This idea of what your state associations can offer you as far as training and certification for your staff, and then also having these opportunities of having someone come in who has a special expertise as in an internship kind of role. So
I was actually thinking about this just earlier today, and I can't believe it didn't dawn on me sooner. If you have a pharmacy school nearby, if you are not signed up to be a preceptor for the students, shame on you. You learn so much from these students, and they bring the students of today have so many great ideas. So I would say first and foremost, become a preceptor for any and all community pharmacy schools near you, right? That's great. But there's also residency programs. ASHP has 100+ residency programs already in place across the United States. Contact them, find out what it would take to create a residency program or some type of internship where you can bring in these people that have these great ideas. And Blair also talked about it earlier. Talk to other pharmacists that you see are doing these types of things. If you are a little bit worried about the competitive nature, which to Blair's point, typically we aren't that bad, reach to someone, if you're in New York State, find someone in Iowa, California, Missouri, somewhere not nearby that would be considered a competitor to you. But there are so many brilliant pharmacists out there today doing amazing clinical services. And we do want to help. Attend conventions when they're in person. Join your local pharmacy board, go to their monthly meetings. So be involved. That's where you're really going to learn, is by expanding your network. Don't let the profession pass you by. Be part of that change so you can have a voice.
Well, I do think we try to write stories about the kind of pharmacists you're talking about who are doing things differently. They find the niche like you're talking about and then really pursue it, and then look to their system vendors to give the tools, either collaboration as far as with local providers or, tracking the outcomes of their programs, which is what we really, we probably could touch upon that. I think, Blair, you probably could also give us some insight on that.
I think, and that goes kind of back to your point about, okay, if you precept students or you create a residency program, Well, what does that person focus on? Well, you're creating programs, not just to create programs, but to align with whatever outcome that is that you want to create. So, if your goal is to, work with patients and HIV, high incidence of HIV in the community, what is the quality metrics that are associated with HIV that the community, that CMS, that the payers, if it's a state-run program, what are those things that the program that are paying for these medicines, the insurance payers are most concerned about? Well, they're most concerned about quality. And if they can get that quality from a pharmacist, I mean, that's our ticket to, a permanent seat at the healthcare table. And so we've got resources. So if you wanted to, send a student or a resident through the PharmapreneurAcademy, we have resources on how you can track pharmacist interventions. There was a 2017 legislation called MACRA that basically created the pay for performance model through CMS at the national level. We've also got HEDIS metrics that the private payer insurance companies are looking at. And so we've got trainings within the academy that basically say, hey, if you're looking to reduce readmissions, here's some suggested programs and suggested pharmacist interventions that you could focus on to make sure your clinical program is aligned with whatever the goals of these quality outcomes are. So pharmacists, to me, are the quality coordinator. We're the quality assurance of the healthcare system. We know evidence-based medicine like no one else knows evidence-based medicine. And we are the people that can make those lifestyle recommendations, those lifestyle modification. We can do patient education. There's so much more than just being a medication expert. That's what I hear a lot of pharmacists say, we're the medication expert. Well, what does that mean? What we mean by that is that we use evidence-based medicine to create better outcomes, to optimize therapy in order to create better patient outcomes. And if we go into a program thinking that, whether we're having conversations with local employee groups, state Medicaid payers, local providers, or even patients themselves, we're always going to come out on top, because if you're focused on quality, that's the missing piece in pharmacy. We've been dispensing with no with a short-sighted view for what does this adherence mean? So if we have 80% adherence to the blood pressure medications, what does that actually mean as far as outcomes? And is there anything else we could be doing to document these interventions so that we can directly tie that to, I said this to this person during an MTM visit, 3 months later, they had made that change, and this was the improved outcome.
And I think to Blair's point, we've kind of focused on the wrong metrics for too many years. We focused on how many scripts we filled a day, how many vaccinations did we give this flu season. We really need to focus on the outcomes of the patients. How many A1Cs did we get down? What percent did we get them down by? And as the most accessible healthcare professional in, I'm going to go out and say the world, not just the country, we are primed to help people and to collaborate with providers of all kinds. I loved hearing that you had pharmacists working in chiropractic offices. You can work with all kinds of providers. You could work with a physical therapist, with an occupational therapist, with physicians, physicians assistants, nurse practitioners, midwives, really oncologists. We can work with anybody because, for the most part, most of those professions are going to be prescribing medications. And, those medications need to be monitored appropriately, as well as non-medication therapy. We have to remember that not everything needs to be, done with medicine. Shout out to all the grocery chain pharmacists out there. Food is medicine, right? Talk to people, work with dietitians in your local grocery stores. So there's just so much we can do clinically wise. We've got to stop focusing on the pills in a bottle and the vaccines and the arms.
Yeah. Well, I think the communication is there now too. Like going back to, we were talking about DrFirst is able to offer as well. Like it's you can communicate, it's not just a text message, pick up your prescription anymore. I mean, like
It shouldn't just be that.
Anyway, right. We're so far beyond that.
Yeah. I mean, that's what I used to get. Your prescription is ready. And I'd think to myself, what prescription are you talking about? Right. Like with our messaging system, we can actually name the prescription that's ready. We can put PHI in there. And, we can put photographs and recordings and all kinds of stuff. So you've got to get, the best tech that you can for a reasonable price. We certainly don't need people going out there trying to get crazy bells and whistles if it doesn't bring you the value. That's the thing. You can spend a lot of money on something that in the end doesn't really give you a lot of value. So make sure you're getting good bang for your buck. But yeah, communication is key, and it's got to stop being telephone and fax. And the fact that it can be a secure group message with all different types of providers, I think is key, because we want to keep the team, we want to keep the healthcare team talking together, not thinking we're competing with each other. We're working with each other, not competing with each other.
You can take away anything from this conversation. It is really that I believe healthcare is shifting. Not just pharmacy, the healthcare system as a whole, really focusing more on preventative medicine and lifestyle modifications in the next 10 or 20 years, because that's, as our generations age, I think that's going to be more what we're looking for as consumers and patients. So change is happening, whether you're ready for it or not. We equip pharmacists to begin thinking like entrepreneurs so that they can see and monetize and leverage their knowledge in new ways. So if anyone wants to learn more about my work and the Pharmapreneur Academy, get access to information about billing models through collaborative providers, how to build a business, how to document and make sure that your programs align with the best quality outcomes, everything can be found at PharmapreneurAcademy.com. And you can hop on our email newsletter, and then we send out a monthly newsletter, just kind of a rundown of things and trends that are happening in pharmacy. So I'd be happy if anyone wants to connect with me there. Just hit reply to any of those emails. They'll go straight to my inbox, and I'll get in touch with them.
Great. Okay.
And for me, it's, don't be afraid of change. Like Blair said, healthcare is changing, and it's changing very rapidly. The pandemic has really caused a shift in how we serve our patients today. And I'm hoping that all the pharmacies that are going to listen to this, they've been able to keep up. But you need to be prepared, and technology is going to get you there. As I recommended earlier, make sure that you stay in touch with your system provider. Make sure that you've got the top of the newest release, that you're taking on all of the functionalities that you're giving you. I've been watching them add all different kinds of great new functionalities for pharmacies to be efficient. If you're presented with the opportunity to try out a new feature, try it out. They want your input. They don't want to give you junky features. They want the features to work for you. And, what better way than to, give them your feedback? Be part of that change. Don't let the change roll over you. Be part of it so that you can lead the way. Pharmacists are great leaders in their communities. So just keep up with that. And just like I said, don't be afraid to change, and reach out. And, you can contact me at DrFirst at hpolek@drfirst.com. I will tell you, this was not the original plan of my career. I never saw myself working for a healthcare IT company. But I love it. I was always interested in technology. I'll date myself a little bit. When I started in pharmacy, there were no computers at all. So I was one of the first listening to those dial-up modems go through my pharmacy. And I just kept embracing it. And I knew change was coming. So I just kept rolling with it and rolling with it and rolling with it. And believe me, I'm no IT, guru expert, but I surround myself with people who know things and can teach me things. So that's another thing. Don't be afraid to kind of admit to yourself when you don't know something, and just reach out to the experts who can help you. We're here to help. That's why we're on this broadcast. We want to help you become the best pharmacist that you can be for your patients and your community.
I think that is a perfect way to end. And I really appreciate you guys spending so much time. We had a really great conversation, and I hope they're good takeaways and people can try something new